So Devin, it's Mary. I'm trying to help admit people who are in the lobby. So
Thanks, Mary. Yeah, I'm just clicking admit too as I'm seeing folks pop up
Yep.
here.
And then Kendi, would you like me to sort of get this started and then turn it over to you?
Yeah, that sounds great. I think that however you want to, on the behavioral health side, to see who's, I don't know if you want to do it. It looks like we have got a lot of folks calling in, so I don't think we do a roll call, but from Medicaid and we want to make sure we introduce the HIEs, and then from Medicaid, who's on and who's on from mental health and addiction services.
I would just start while people are joining. This is Mary Haller with the Ohio Department of Medicaid, and we are still admitting a lot of people. We've had a lot of interest in this call, so if you all could be patient with us while we're getting people admitted to the Teams meeting. We decided to do this as a Teams meeting instead of as a go-to webinar because we wanted to make sure that people were able to verbally ask questions and have conversation back and forth, and it's a little bit easier using Microsoft Teams than it is with GoToWebinar. So just going to mute myself here while we wait for other people to join. Okay, well, it's 3:35, so I think we probably ought to go ahead and begin the meeting. Again, this is Mary Haller with the Ohio Department of Medicaid. We want to thank everyone for joining us today. Welcome, and we appreciate your interest in the opportunity for health information exchange services and expansion. We have a number of colleagues here with us from Medicaid and the Ohio Department of Mental Health and Addiction Services, and then also from both of the health information exchanges in Ohio. So let me begin by suggesting that folks mute themselves if they're not talking, and that way we can avoid a lot of background noise. So, if you want to type your question, you can use the chat window, and or you can unmute yourself to ask a question or speak during the meeting. This meeting is being recorded, and a playback file will be posted to our Ohio Medicaid Behavioral Health website. And that is, for those of you who don't know, it's bh.medicaid.ohio.gov. This is the information slide telling you a little bit more about that recording. We intentionally wanted to record this meeting because we knew there was a short notice, and we wanted to make sure that if interested stakeholders were not able to attend, they could see the meeting. Both the meeting and the slides will be posted to the bh.medicaid website. And today's meeting is only containing public information. There is no information that will be presented today that isn't already public. For example, no protected health information or anything that's proprietary or otherwise protected. So we are fully in the public realm today, and I wanted to make sure that folks know that. Okay, next slide, please. So this is the agenda for our presentation today. Wanted to begin by introducing folks from the state agencies who are with us today, and then to ask Kendi Markman, my colleague from the Department of Medicaid, to introduce our colleagues from the two HIEs, the two Health Information Exchanges. So as I said, Mary Haller from the Ohio Department of Medicaid. Why don't other folks from Medicaid and MHAS quickly introduce yourselves?
This is Peggy Smith from the Department of Medicaid.
Hi, this is Angie Bergerford with the Department of Mental Health and Addiction Services.
Who do we have on from legal and Medicaid?
No one is speaking up, Kendi.
Is
But why don't
just-
you introduce yourself?
Sure. I'm Kendi Markman in Medicaid. I'm the Chief of Clinical Analytics in our data governance area.
And Dawn, are you on?
Hi, Mary. Yes, this is Dawn Pittenger. I'm with Kendi's area in data governance and clinical data.
Very good. Any other folks from the state agencies who want to say hello and introduce yourselves? Okay, well, with that, I'm going to turn the floor over to Kendi and ask her to review this opportunity and to introduce our colleagues who are with us from Ohio's two health information exchanges.
Sure. First, I think I'm going to let each of the HIEs, I think probably Alex and Dan, maybe just both of you, if you're able to speak and introduce yourselves and your organizations.
Sure. Good afternoon. This is Alex Valancourt. I'm the Senior Vice President and Chief Information Officer with the Health Collaborative.
And this is Dan Paoletti. I'm the CEO of the Ohio Health Information Partnership, which operates CliniSync.
All right, great. Could you go back one more slide so I could start with this? Okay. So hopefully you guys saw the information release on the opportunity for behavioral health services to apply for expanded HIE services that went out last week. And you can see that what we have posted there is the direct link to the MITSBITs that went out last week. And we're just going to kind of walk through what this opportunity is. Next slide, please. So specifically, we are offering opportunities for different types of technical assistance and services from the health information exchanges, which we will describe and allow questions to be asked directly to the HIEs. But essentially, just to start with, this is This is an opportunity that actually is coming about because we have a funding stream at Medicaid. And so this is very specific to providers who are behavioral health providers that contract with the Department of Medicaid. And it's a funding stream that you might have. I was muted. It's a funding opportunity through Hie Tech, which is something that CMS funds for Medicaid. And it is the actual federal dollars that come to us are matched at a very high rate. So we get a 90-10 match for this type of funding. And in it previously, we were mainly only allowed to use it with other types of providers to meet meaningful use requirements around electronic medical record systems. And you might have heard of our MPIP program, and it is something that funded our MPIP program. Now we're extending some opportunity in this realm to behavioral health providers specifically who were not included originally in the meaningful use, the funding opportunities and different opportunities for meaningful use. So some of the, just to level set, that we have some very basics that we have to put out there in terms of requirements to take advantage of this potential opportunity. The first thing, just to make clear, that in order to take advantage of this opportunity and actually get these services, is that if you're a behavioral health provider, you have to have an EHR, an operating EHR. So that is one of the requirements that we that CMS that were required in our actual funding stream from CMS. That is something that we're required to mandate in order for providers to be considered for this opportunity. The second thing is you have to, as a provider, be enrolled in Ohio Medicaid under a tax ID that has both a provider type 84, which means community mental health center, and a provider type 95, which is a substance use disorder clinic. That means that you could have just one of each under one tax ID, or you could have several. You could have 5 or 6 of each. And we do see a whole variety of those within our system, but this is an opportunity that is extended to providers that provide both types of services, and so that is a requirement also. In order to be considered for this opportunity, you have to have both of those providers within Medicaid registered under a single tax ID. And then what we're going to talk about today is that it's not there's no opportunity for actual financial assistance. This is really around services and technical assistance. That is just again, some of the requirements flowing through the federal dollars into Ohio's Medicaid program. That is what we're limited to for this particular opportunity. And in order to be considered, you have to take our survey that is posted, and we're expecting them to be completed by April 9th. Those survey questions also went out, I believe, in a Mitspitz, and there was a link to a survey that we'll go over here, but that is also a requirement in order to be considered for the opportunity. You must fill out the survey. So just to start off with those fundamental requirements in order to be considered for this particular opportunity, just to level set the playing field and describe who is actually eligible. Next slide, please. So the actual services that we are offering through this opportunity are offered through our health information exchanges, CliniSync and the Health Collaborative. They are 5 different basic services, And one that is not on this slide, but I would mention that if you are a provider that's not already onboarded to an HIE, that is also an opportunity to get onboarded through this specific program, this funding opportunity. So the 5 services are the community health record, and you can see what it offers there in terms of providing a comprehensive patient record reflecting unified care sources and clinical results received from different data sources that are integrated into a single longitudinal record. Another service is what they're calling results. They're delivering secure clinical results between data sources and their recipients. Both HIEs offer real-time, secure, discrete clinical results, improving the workflow for clinical staff and outcomes for patients. The next service is they're calling direct, integrating communications among providers with a simple, secure, and cost-effective solution. Hie Direct Messaging is a HIPAA-compliant, secure method for exchanging consolidated clinical document architecture. You know them as CCDAs if you use those. Direct can be accessed via the web or integrated into electronic health records. Notifications, helping clinicians keep track of patients in real time, and HIE notifications inform providers about a patient's medical encounters, which supports care coordination and reduces readmissions. And then data, and they refer to these as connected communities. And again, the continuity of care document and admit discharge transfers, ADTs, they can be delivered to the HIE to be normalized and consolidated for query and retrieval by providers, and ATT notification sent to referring providers to indicate closed referral loops. So these are all, and one, I think, part of the opportunity that we sent out. You are able to, and they can answer questions around this, but you are able to sign up for one of these services or all of these services, and the opportunity allows for any combination of the services. So I think that that's something that we know that there are providers now that might only receive one of these services, but you would be eligible to receive all of these services so through this opportunity. So the way that this is working is that you would be potentially able to receive these services on a complimentary basis up to 3 years. So that's essentially the services, and I'm going to allow everybody to ask the HIEs very specific questions around these services. But those are what we're offering at this point, in addition to the basic onboarding and TA around that. Next slide, please. So the survey is you can see that we opened it up on April 1st, and as Mary Haller pointed out, it was not an April Fool's joke. And the close date this is a quick turnaround time because by April 9th we want to get results back, and we need this in order to complete our contracts with the HIEs on this project. And the way that this will actually be operationalized, we have a very tight time frame, and I think maybe the next slide gets into that. But if you go to the next slide, please. Okay, so I'll just talk about the timeline and some other things around the survey. For those of you who have clicked on it, I know you probably will have some questions around the survey, so I'd like to take those. So as well as to discuss the actual technical assistance and the services, the questions that you might have for the HIEs there. In terms of the timeline, we were collecting the survey results, and then we would review them and then decide, with our mental health colleagues, the providers that meet the requirements that are eligible for this opportunity. We'd be notifying the providers who would actually be eligible for this opportunity in moving forward with the services and technical assistance with the HIEs. And then it's a very short time frame in terms of trying to get this rolled out. This particular stream of funding that we get from the federal government, we have to have everything closed out by September 30th of 2021. And so in order to kind of back that up, the way that we anticipate it rolling out is there would be initially some providers that we'd be able to actually work with in June, very minimal, and then the bulk of the work would be done in July and August. So a very short time frame in order to get it done, but we're really excited to offer the opportunity to behavioral health providers. And so that's our short time frame, and that's why we're asking for such a quick turnaround on the survey results. In terms of the survey itself, I don't know how many of you have actually clicked and gone through it, but the survey is set up to be pretty simple. And the questions ask first just your provider information, which is really necessary for us to have in terms of your tax identification number.
So,
and in,
Kendi,
I'm sorry,
if I could just interrupt and say, Dawn Pittenger actually is prepared to walk through the survey with the people who are on the meeting. And I don't know whether you want to do that before we allow people to ask questions of the HIEs. What's your preference in terms of the order?
My preference would be, Dawn, let's go ahead and walk through the survey. And then after you walk through the survey, you can, we'll open it up to questions then. How about that? Just to make sure that everybody, it gets real confusing when people start coming off mute. And so let's go ahead and walk through the survey. Let's pause and see what the questions are just around the technical assistance opportunity itself and the survey. And then we'll go on and see if there are questions specifically for the HIEs. How about that?
Very good. Sounds good. So Dawn, right. Are you ready to walk us through the survey?
Hi, Mary. Yes, I am. Okay, and so someone's scrolling for me. Okay, great. So I'm going to do just a couple quick general notes on the survey, and then I'll go over a short overview of the survey. So the survey is designed to assist with the next steps of this project. You'll find the link in the MITSBITS or in the presentation that we'll post after today's information session. It's designed in Microsoft Forms, and you can access it by desktop or mobile device. And of course, it's open from April 1st to the 9th, and it will close on the Friday, April 9th at 11:30 p.m. While it's open, you can navigate to it using your preferred device and your preferred browser. You'll arrive at this initial survey introduction page that gives you an overview and purpose and instructions for completing the survey. A couple quick notes are that incomplete surveys are not saved, so no submission until you see the confirm thank you screen. And if you're unable to submit in the same attempt, for example, if you leave and need to come back with information, you'll have to start over, and that is fine to do. Just make sure you make it to that end screen where it says, thank you, your survey has been submitted. And then, of course, if you do have any issues during the survey or need any technical assistance, contact us at bh-enroll@medicaid.ohio.gov. And so the survey is estimated at completion time around 5 minutes. Right now, average is about 10 minutes. And it's designed with smart logic or branching, and so your time is going to vary depending on your answers that you give. And so the initial question that everybody gets is in this section 1 with the current status and readiness. It's going to ask you your question, or a question around if you are currently using an electronic health record. And then if you say yes, it branches on to ask you what that vendor name is of your EHR. And then the next page goes into asking if you're connected to a health information exchange or HIE. If you say yes, it will ask you which one and what services you are currently receiving based on the options below for number that you see on number 5. If you had said no, it would then branch you down to asking on question if you're interested in receiving additional technical assistance from an HIE in general. So that's where the smart logic comes in. And then if you can scroll down to the next question. If you have gone as far as saying that you are interested in services or you are interested in additional services, you will see the same list of HIE services that Kindy had described earlier that's offered by both of the HIEs. So that will be at the top of section 2. You can refer back to that while you're answering the next questions that will come up. And so then you're going to be asked to indicate out of those options which ones you are interested in. You can select multiple. And then you're also asked if you are going to be wanting assistance with connecting to an HIE. You're going to be asked if you have a preference of an HIE connection. That was a very big point for our survey, is wanting to make sure that the providers have an option for HIE selection. And then the contact section, you will arrive at the contact information screen regardless if you give consent for contact, only because we want to use this information for survey validation. Before you get to the contact information screen and enter your contact information, you'll be asked if you consent for an HIE to contact you. You can say no, and then it will take you to this screen and it will let you know that you're only going to be contacted if you had selected yes and consented to that contact information being shared. And so this section here has a couple different pieces of key identifiers so that we can validate this information with the information that we have on file. And so as you see, it gives you instructions on the data fields that we would like for you to enter and how we would like those to be entered for consistency and for matching. And if you can scroll to the next section, please. Thank you. And then section 4, this is the consent and confirmation section that you will receive before you go to entering your actual contact information. So we just wanted to be clear that when and if you would be contacted, and if you see these screens before you enter your contact information, that's how you will know that information, and we will also have that on file for validation later. And then of course, your survey is complete when you see this screen. And
Good.
so if you have any issues, you can email the bh-enroll or -enroll at medicaid.ohio.gov. And then of course you can visit the Medicaid newsletter section for the MITSPIDs and future MITSPIDs.
So
thank you,
Mary,
Dawn.
could we open it up for questions for on the survey, or
Yes.
how to
Yes.
any questions around who's eligible?
Yes, I was going to start with, there's 2 or 3 questions that have been typed in. So a couple of them are about the survey. We filled out the survey, but used both HIEs and had to select one, and that was the only option. So I think the question is, if an agency is currently receiving services from both of Ohio's HIEs, what are their options in the future?
I think so. I know that the survey right now, you can only pick one. Is that right, Dawn?
Correct.
There? Okay. I would, so if there are providers that are working with both HIEs, would it be okay, Mary, if they emailed us and told us about that?
Please, that's fine. You can. So this is Mary Haller. I actually staff the BH-Enroll website. So send an email about your questions, and we will get them to the right person and get back with you. So the second question here is about what if you represent numerous facilities? So I'm assuming that it's either more than one location, or it is someone who is affiliated with more than one facility.
And so if you fill it out, we would want it filled out for each tax ID that you have. And so you have a tax ID, and then if you have, let's say, 5 different Medicaid provider IDs under that, we'd want to have a survey filled out for each Medicaid for each tax ID. And then all of the Medicaid provider IDs that you have associated with that tax ID. Some providers might only have one Medicaid provider ID associated with a tax ID. Others have quite a few, 10 or 11 I've seen in, and so that is what we would like, a survey for every tax ID.
Okay. Those are the questions so far that are in the chat. And to the question of how to reach Mary, the address is bh-enroll@medicaid.ohio.gov, and it's in this presentation. And can you flip back? Yeah, there we go. Thank you. All right, so I would say, Kendi, it's time to open up for questions and for comments or responses
Yep.
from our colleagues with the health information exchanges.
Yeah, so I think that what we wanted to do here to kind of I think that we wanted Alex and Dan for you guys just to talk. And so I see some questions already coming in. Let's let the HIEs talk first about, in their own words, the services that they're offering and any additional information that they want to provide. Just to give a quick overview of working with them, I think that we'll start answering questions after they can give a brief summary.
Dan, you want to start?
Sure. So this is Dan Palette again with the Ohio Health Information Partnership and CliniSync. I think the services that Kendi went over gave you a pretty good overview of what's being offered through the program. In our particular case, those services are provided both in an integrated and non-integrated fashion with EMR, so it really is dependent on what the organization wants to pursue, and some can be set up fairly quickly. Others, the integrated ones, tend to take a little bit of time, but as ODM mentioned, this is a 3-year project, so again, you can get started with something right off the bat and then work towards something more integrated as we move forward. So we'll just pause there.
Yeah, and if I can add to that, first I would just say that, it's great to see the state of Ohio trying to help encourage this, and Medicaid in particular. We've been, for those of us who have been in healthcare for almost 30 years, the idea of sharing patient information between, provider and patient, or provider and provider, have been conversations that have been going on for that amount of time and more. And we're finally to the point where, that even at the federal level, there's a lot of encouragement for interoperability, new regulations, et cetera. And I think this helps kind of promote that within, behavioral health space, that as we're all learning more and more, connecting that to our healthcare, the traditional hospital-based care is certainly a kind of a goal everybody has. So pretty exciting opportunity here.
All right, thank you guys. So I'm going to just start going through the questions that I see after. Is that okay, Mary?
That is absolutely fine. I'm trying to respond here to a couple of them in writing, so yeah. Just trying to keep track.
So the first question that we have after the ones that we've gone over so far is, does the funding only cover the cost of the HIE and not EHR interface costs? So it's not, so to kind of reiterate, it's not actually funding or financial assistance. It is the actual services with the HIEs, as well as the technical assistance. And so it would not cover the EHR interface costs. The next question that I see is on the survey. It says the survey doesn't let you add more than one Medicaid number. Now, Dawn, I think, I can't remember if we just were allowing them to enter Medicaid numbers as a list, or if there was a way to enter multiple Medicaid IDs for under a tax ID.
The survey right now states to enter at least one Medicaid ID that is listed under your tax ID.
Can they add the multiple Medicaid provider numbers?
It is a numeric entry, so technically they can only enter one Medicaid ID for it.
Okay.
We were really focused on the tax ID.
And so
could submit another.
So I would just say enter one of your Medicaid provider IDs. We do know, so in our system, of course, we have a crosswalk of all of the tax IDs and then all of your Medicaid provider IDs falling under that tax ID. So as long as you enter your tax ID, we will know all of the Medicaid provider IDs underneath your tax ID. The next question is, if we are in the process of implementing some of the items listed with checkboxes for the survey question 5, but have not yet completed implementation, should we check the box or not? I would say unless you already have those services up and running, I wouldn't check the box. Is there a place for any kind of explanation, Dawn, on the survey?
No, not for that section.
Not for that side. Is there any place that they could type in anything for us that is a comment box or anything?
They may be able to do it in the other.
Yeah.
Where there is an other option.
I would actually explain that in the other in the other option that you're in the process of implementing, and say what services you're currently in the process of implementing with which HIE, and fill that out as part of the other response.
Thank you, Kendi, for correcting me on that. My response to that question was to check the items your agency was in the process of implementing. So I apologize for giving misinformation on that.
That's okay. Question, as this opportunity is aimed at provider type 95 and 84, how are the HIEs addressing Title 42? This is CFR 42 Part 2, protected information. That's a great question. I'm actually going to turn that over to Dan and Alex to answer.
This is Dan. I'll go ahead and go first. So there are several different situations when it comes to the Part 2 data. We find that there's still several different options to contribute information if that is possible. Some because Part 2 is inapplicable in those particular situations, or in some cases it can be excluded. There are some changes that are coming to HIPAA. We're waiting on the final rules to be published around the Part 2 consent and aligning Part 2 more with just general HIPAA. And if we are, from what we're hearing, as those two align, it will be much easier to contribute the Part 2 data and make that shareable among providers. On the CliniSync side, we're going to wait till those rules are finalized before we implement any specific Part 2 consent layer, because again, the hope is that that will just be aligned with the rest of the healthcare data. So I think there's plenty of opportunities. It would take a conversation with each organization to determine the best route forward.
Yeah, this is Alex from the Health Collaborative. Similarly, part of the onboarding process for this kind of an initiative is a pretty in-depth understanding of your organization, and obviously of making sure that we understand clearly that you fall under the part 2 data, and if you are a SAMHSA part 2 provider, and making sure that we've got that ironed out early in the process.
All right. So next question. For clarity's sake, based on comments of no funding, by saying it covers services, does it mean this pays for the fees associated with these services? E.g., if we want to use the CliniSync Notify, will this pay for that use? Yes. So those are the questions that I'm showing so far. Are there other things that people would like to ask?
And people who are in attendance, feel free to just unmute yourself and
raise your hand, maybe,
and talk, introduce yourself, and ask your question verbally. So feel free to do that. It's hard for me to imagine that there aren't more questions. I hope that people feel free to ask, because this is really the opportunity to do that.
If you change EHR in the next year, would there be any impact issues? I'll let Dan and Alex answer that.
No, it wouldn't. It just, we'd want to plan for that, because you probably wouldn't want to go through the integration with your current EHR if you know you're going to replace it, and really focus more on the non-integrated options. And then once you implement the new EMR, look at the integrated options.
Yeah, I was going to say the same. It depends on the services, and similarly, you wouldn't want to go too deep into integrating with your current EHR.
Will the presentation be posted on the website? It looks like yes, correct, Mary? That will be posted?
Yes, both the presentation and the recording of this presentation will be posted at our bh.medicaid.ohio.gov website.
Okay. If we have, I see some hands raised. I'm gonna try to go through the messages first here that we just got. If we have a go live in October or November, but have the interface built by September, does that qualify? I'm going to have to take that back to our legal area to have that one answered. I don't want to say one way or the other without talking to our fiscal and legal area on exactly how the our funding stream works that way. How long do these funds last, and do we know what dollar this equals as far as a dollar amount per year, i.e. if this grant runs out, what are we looking at for an annual bill? So this is the opportunity is for the services, complementary services of any combination of those 5, including onboarding, for 3 years from the time that you are hooked, essentially start receiving those services. in terms of the dollar amount per year, I don't know if the HIEs want to respond to that. I'm sure that pricing, differs depending. This is kind of a special package that they put together for Medicaid behavioral health providers. So I don't know if they have any comment on that.
This is Dan.
Go ahead, Dan.
I was going to say, this is Dan from CliniSync. What we would do is on the onboarding process, explain what, if any, costs would exist after the 3-year period. So there were no surprises, just so you knew that going in.
Yeah, this is Alex. It'll depend a bit on the types of services and right, and at the end of the 3 years, which ones continue that you choose to continue.
All right, the next question is, just to clarify, would this make us both a contributor to and consumer of the data? I believe the answer is it depends on the services, but I will let the HIEs answer that one as well.
Yeah, it does depend on the services. We intentionally tried to create a menu of the behavioral health provider being a recipient of data and or a supplier of data. So each of those services were a combination intentionally selected from that reason.
Yeah, this is Dan. I would just add it's the opportunity is to do both in these, what ODM is offering.
So the next question is, will there be a requirement for physical health providers to submit data to HIEs, at least for Medicaid patients? The issue is that not all medical providers participate, so we only get partial data. This particular opportunity doesn't have, we're not requiring anything of any providers, and nor does Medicaid require our providers to submit to the HIEs. And so whatever data is there and whatever providers participate with the HIEs, it's outside of the scope of this project. Is just an opportunity to get technical assistance and services, but we're not requiring anything of Medicaid providers in terms of participating with the HIEs. The next question that I see here is, if the funding does not include EHR interface integration, how will the information be shared with providers? Integration is extremely expensive. So I think that was a piece of the it was something that was not included in how our funding stream from the federal government. It just would not allow us to provide direct funding for the EHR interfaces and integration. So it wouldn't allow us to pass actual funding dollar amounts onto the providers. So we recognize that integration is extremely expensive. And I don't know if the HIEs have any suggestions there in terms of working with different EHR providers.
Yeah, this is Alex. It has depended for us on the type of EHR. So if it's one that we've had experience with, many of the EMR vendors have created what they call a hub, where they host the system and multiple providers will share in that. And often that can help reduce the cost. And if we can intervene sometimes to operate on behalf of multiple providers to that one EMR vendor and offer to split costs in various ways, that can help. If it's an EMR vendor that we haven't had experience with, obviously that gets a little bit more challenging.
Yeah, this is Dan. I just offer, we've negotiated pricing with most of the EMR vendors, so hopefully that will assist. And there are some, again, options for kind of not very sophisticated integration that can also be pursued, which can help with the pricing as well.
Thank you. The next question I see in the chat box is, we serve several counties. Will you help us decide which is the better choice? can you have both? So the way that the contracts will be set up, I have to be careful how I answer. I need to check with our legal whether you can actually have both for different services or not. But we will, ODM, the short answer is ODM will definitely work with you to help on the decision of which HIE that you would be most appropriately matched with. And there might be an opportunity to work with both as well, for this opportunity to extend to you working with both. But that is something that I do have to table and take back to our fiscal and legal area. I see hands raised, but I can't tell who they are. Mary, are you able to?
I see Nicole Moran has her hand raised. Nicole, would you like to ask your question?
Sure, thank you. I was wondering, is this a competitive opportunity, or will everyone who applies and is eligible be able to participate?
Interesting. So in order to participate, as you know, there are certain eligibility requirements that we stated up front in terms of having an EHR and having a tax ID, which extends to Medicaid providers that deliver both community mental health as well as SUD services. So there are, you know, a few eligibility requirements that you have to complete the survey. All of those that you have to do to be eligible. In terms of, the question is if there are if it will be limited in any way in terms of if everybody who completes the survey and wants the services will get them. And I think right now we are waiting to see the results of the survey, and we'll be able to give you more information on that after we actually see the results of the survey. I think that depends on how many providers are interested and how the survey responses come back. But we certainly encourage you to answer the survey, and if you're interested, I think that this is a great indication to us as ODM and the state that we know that there's interest in this area. So we will try to work really hard to extend the opportunity to as many providers as we can.
I see another hand raised, Carmen Adolphus. Carmen, would you like to ask your question?
Yes, hi. What is the typical time frame for onboarding, and who usually attends the onboarding session?
I'll let the HIEs answer that in terms of onboarding.
Yeah, this is Alex with the Health Collaborative. It varies depending on the services that you elect. Generally, we'd want, you know, somebody who's quite familiar with your practice, operations involved in that. Sometimes, if you're looking for deeper integration, we would also request to have somebody from your technical team, if it's outsourced or in-house, be able to join that conversation as well.
Yeah, this is Dan. I would say what Alex said would also be true for us. I think the other piece of this, again, there with the services that were outlined, there is both integrated solutions and non-integrated solutions for each service. So it is feasible you could get up very quickly on the non-integrated solution while you're working towards integration. So for example, accessing the community health record through the web-based portal can be set up pretty quickly. But if you want to query directly from your EHR, that project might take 2 months, depending on the integration on your side. But you could start accessing the information quickly and then eventually do the integrated solution. So it just really varies.
All right, I see more hands. There was one other There's something in the comment box that that somebody said that they completed the survey and it only allowed one of the Medicaid provider IDs. That is not a problem as long as you put your tax ID. We will know your other Medicaid IDs, so not a problem there. Who else has their hand up?
I am looking and I can't see right now. Can
There's a
Alex-
Carmen Adolphus. that
Carmen
has-
just asked her question.
Oh, okay.
Yeah, I think that's the only hand remaining up, Mary. I'm just taking a quick scan through here. That's the only hand
Thank
I'm
you.
seeing.
Appreciate your help.
Okay, for non-integrated options, which of the HIE services should we select? I believe that is up to, I think that is up to you. In terms, I guess I'll let the HIEs answer this and what they would recommend.
Yeah, this is Alex. You know, part of that, what we would intend is that once we get the go from ODM to reach out and set up an initial discussion, kind of talk through those options and which ones are appropriate, which ones are not appropriate, which ones involve cost on your part with your EMR vendor, which ones don't, and really kind of help you, you know, educate a little bit on what those options are a little bit more clearly, and then kind of go from there. So. Yeah, no worries. Hopefully I don't think you're locked into whatever you select on the checkbox. I think it's more of an initial, what's your intent? And then we'll work through details there.
Yeah.
So I would encourage then when you're filling out the survey, if you have any interest in the services, I would check all the services that you're interested in at all. Okay, and please go ahead. I'm sorry to cut you off, Dan.
No, that's what I was exactly going to say. If you're interested, check the box. And, you know, that's because, again, this is a 3-year program. So you may want to get one of the services started right away and another one phased in later. So, again, I would just check all that you're interested in.
Okay, we only have a couple of minutes left in our meeting and wanted to see if there's any final questions. Would probably be quicker to just unmute yourself than to type. Kendi, do you want to do a quick wrap up in terms of next steps? I know that step number 1 is to complete the survey. And then I don't know what the next steps are after that.
Sure. And so I think that after we get the survey results back in, that we will be getting back in touch with the providers after we review the surveys within the month of April to give you guys an update. So please get those in, and then we will be working on reviewing them within the next week to 2 weeks after we receive all of the results. So please let us know if you have additional questions through the email address that was given above, and fill out the surveys. We're really excited to extend this opportunity to everybody. Thank you for joining the call today on such short notice, and please pass the information around.
And again, all of this information that was presented today will be, the slides and the recording will be posted to bh.medicaid.ohio.gov. Thanks everyone for joining today.
Thank you.
Thanks for having us.
Thank you.